Okay, this is Deja. I guess it does seem to work where people can unmute themselves.
Great, awesome.
Okay, so Carol, though, if you can, since I am gonna join on my phone, like as
Mhm,
the panelist side.
mhm.
So if people, I guess in the beginning, though, I will like let everyone know that, if they have questions throughout the webinar or, at the end that they should be able to use the raise their hand function and like we'll unmute you or whatever.
Sounds great. And I can monitor that.
Okay, thank you so much. I'll also keep my eye out for the like if people do put stuff still in the Q&A, I can still me and Amber can still like kind of go and read through those. But mostly just to see if people want to like actually talk. If yeah, you'll keep a track on that.
Yeah, sounds great.
All right, thank you so much. I did not know we could do this, so I appreciate your help.
Yeah, of course.
All right, well, I am gonna send the link over to Center Air, make sure she's good to go, and then yeah.
Great.
All
I'll
right.
just monitor the Q&A.
All right, thank you.
Thank you. And then Deja, just to let you know, my boss is about to get on as well.
Hello, everybody. This is Asia. See, everybody's on. And I'm just gonna share my screen just for while people join on with this like title screen. But then as soon as we actually join or get the meeting started, then Dominique or Megan, you guys can go ahead and share your screen. But we'll get to 12 and give a few minutes for folks to join on. And I know Senator Ingram, Senator Hicks Hudson, they'll be joining on here in a minute too. So.
Sounds good. Thanks, Deja.
Good morning.
This is WXGS Toledo, 88.3 FM.
Hi, Senator.
Hi.
I think
I
we're
like this screen. It looks nice.
Yeah, Deja did that. I think we're still waiting on Senator Ingram.
Oh, no worries. I'm gonna go heat up my lunch. How are you doing this morning, though?
We're good in here. It's slow.
Yeah. No, I understand. Apparently they had conference committee on dealing with the marijuana legislation. So I don't know if you guys received any information about that or not yet.
We haven't, but we can ask Patrick. Also,
Yeah,
oh, sorry.
no, go on.
I know that that's not anything that um is like confidential, or I just wanted to make you aware that the other hosts though are on as well from DCY and Cradle Cincinnati.
Oh, okay. Hi, ladies, gents.
Hey, good afternoon.
Hey, good afternoon. I'm so glad you all um are joining us.
We appreciate you all having us.
Yeah,
Yes, thank you for inviting us.
Yep, thank you.
you're welcome. You're welcome. We'll wait a few minutes because it's just now 12:02 and waiting for Senator Ingram and probably some more folks to jump on.
No worries.
Yeah. And thank you, Amber, before I started talking crazy talk.
Yeah, I just wanted to make sure you knew.
It's all good. It's all good.
I just got off the phone with the senator. She should be joining on here in a second. Thanks everyone for waiting as we let people kind of get into the call. And thank you all for being here today. Senator Hicks Hudson, I don't know if we want to just go ahead and kind of get started, and then Senator Ingram will join on. And so we can welcome everyone that's on the call right now.
Yes, I think we should get started. It's 12:05. So
Yeah.
I think you can see me, oh, sort of kind of maybe. But
Here
okay. I want to welcome everyone to this says December meeting. But we're still in the great month of November and a time of Thanksgiving. So however you want to look at it, whether today is, we do know it's November 20th. And after a long night in the Senate, I'm just grateful that we're all here to really talk about an issue and learn about some ways in which we are, as a state, addressing the issue of maternal health. With that, I'm going to turn it over to our trusty senior aides, who are really the rock stars that help us keep this caucus on task and on track. So Deja, Amber, if you want to just introduce our guest.
Yeah, thank you so much. Good catch. I just seen that it says December after that long night, maybe. I lost a few
Yeah.
minutes now. But no, thank you all again for being here today. I'm Deja. I'm Senator Ingram's senior legislative aide. And today we're joined with some folks from Cradle Cincinnati and Queens Village. They've been doing a lot of amazing work down in Hamilton County, reducing the infant and maternal mortality rates and making sure we have healthy moms and babies. So they are expanding their program throughout the state because it's worked so well. And, other parts of our state could definitely benefit from, the model of care that they utilize. And so we have Megan and Dominique today. I know they're going to be doing some presenting. And so I can stop sharing my screen so that you all can go ahead and share your screen. And then we can get into our meeting. So thank you both for being here.
And Deja, if you will, I apologize for jumping in, just as housekeeping things to remind everyone that this will be our last meeting of the year. But in the email that we sent out, we are inviting everyone to join the Doula Advisory Board Zoom. That'll be happening at the beginning of December. So the dates are all in there with the link. And then we'll be sending out a newsletter at the end of the year with the wrap up of everything that we've done in 2025 and a reminder about our upcoming summit in April. So if your organization would like to participate or support, please feel free to reach out to us via that save the date email or the newsletter. And without further ado, our guests for this month.
Hi, everyone. I'm Megan Vogel with Cradle Cincinnati. I'm also joined today by Dominique Walker and Dr. Jim Greenberg, who is one of the co-founders of Cradle Cincinnati. And we're discussing our work with Partners for Change, kind of a statewide initiative to reduce infant mortality. We also want to acknowledge that it's Prematurity Awareness Month, so we feel especially grateful to be presenting now to kind of bring timely light to this issue. Dominique, do you want to kick us off?
Absolutely. Thank you, Megan. So good afternoon, everybody. So I'm just going to start with a very, very high level of Cradle Cincinnati. And so we are a collective impact collaborative nonprofit organization that sits within Cincinnati Children's Hospital Medical Center. And so a lot of our work, some people may be familiar with, but we do have multiple teams that sit within Cradle. And so we have our Cradle Cincinnati Connections team, which is our direct service arm of our work. It's a team of community health workers who are working directly with families to connect them to needed services, things like pack and plays, assisting with like housing applications, food insecurity. And then we have the Learning Collaborative, and that's the arm of our work that works specifically within the healthcare setting. And so working a lot with prenatal care providers, as well as other birth workers that support mom and baby and the overall families throughout pregnancy, and then, in the hospitals when they're giving birth and postpartum. And our Queens Village arm of the work. This is the arm that focuses on amplifying the voices of Black women. And so we have some additional information on the next slide that we'll chat about that specifically talks about Queens Village. But there's just a lot of programming that occurs within Queens Village to, again, center the voices of Black women, to create an ecosystem where Black women feel heard, they feel seen, with the focus on rest, relax, and repowering. And so a lot of the work that we do at Cradle embeds the voices of the women from Queens Village, and a lot of our work to help guide us, but to also help ensure that we're on track with the initiatives and the efforts that we're putting forth, and that we always have Black women's voices at the center of the work that we're doing.
Hey Dominique, I'm sorry, I don't mean to interrupt.
No, you're fine.
I don't know if you all can try and like re-share your screen. I'm able to see your slides, but I guess the audience isn't able to see the slides. So
Oh, so let's see. Janae
someone
said
just
it's
fixed.
fixed. Can everybody see slides at this point? Okay. I see a couple in the
Okay.
chat saying they can see them. Thank you for that.
Okay, perfect. Thank you.
Yeah, of course. And then the kind of newest initiative of our work is Mama Certified. And so Mama Certified is an equity initiative that looks to improve the experiences and outcomes in birthing hospitals in Hamilton County. And so this really brings together the work of Queens Village, so the voices of Black women, and then our healthcare settings, to improve how women are getting care in our birthing hospitals. And so as we kind of talk through this, again, there's some additional information we'll talk about on future slides, but just wanting to kind of create that framework of what all falls within Cradle Cincinnati, because a lot of these kind of stand alone in some of their work. And so people are familiar with them independently, and just wanting to show how they fit within the larger scope of Cradle Cincinnati. Next slide, please. Okay, and then this is just a visualization to kind of share the Queens Village model. And so there's, kind of these two larger components where we have the organizational leadership. So we do have community advisory boards that help to, again, give voice to Black women in the community, empower Black women, as well as offer opportunities for listening and learning. And then within that space, you have community leaders at the table, and then Black women with lived experiences that get to really help shape the work that we're doing and provide that amplifying of the Black women's voice. And then we have our institutional leadership, and this looks like, some of those on our team who sit here within children's, as well as marketing, media, different campaigns, researchers, but then just showing how we all kind of come together with communications at the core of all of this, to be able to do the work that we do and to reach the community the way that we do. And then we have Cradle Connections that touches a little bit of all of this, because they are the team that's, really kind of one-on-one with families and highlighting what are some of these needs. And so they are, helping those families that they encounter get connected to Queens Village, and just helping them to get access to all the things that they need for, basic needs, and to be able to hopefully live thriving lives. And Megan, I will kick it over to you because I think you have the next slide.
Thank you.
Mhm.
So there's an infant mortality crisis in the state of Ohio, as seen as kind of in our Partners for Change work and the response to that crisis. But in 2013, Cradle Cincinnati was founded to support infant mortality reduction efforts in Hamilton County. In 2023, we were thankful to document a significant decrease in our infant mortality rate, and that decrease was also, we achieved the national average at that time. So in 2025, in 2024, the Department of Children and Youth contacted Cradle to partner with us to create the Partners for Change initiative. So in May 2025, we kicked that initiative off called Partners for Change. And in Partners for Change, we work together with 4 Ohio counties to support coalition building and kind of utilize this collective impact framework to reduce infant mortality. So our partnership began in 2025, and then it runs through June 2027. And it's a statewide coalition of 4 counties. So it's Cuyahoga County and First Year Cleveland, Franklin County and Ohio Better Birth Outcomes, Montgomery County, it's Roots to Rise, which is located in Dayton Children's Hospital, and then a Health Council of Northwest Ohio, which is in Lucas County. And all of this partnership is kind of spearheaded through the Ohio Department of Children and Youth and us. So we're all working together throughout the initiative to kind of collaborate and partner to reduce infant mortality across the state. So our core principles for kind of guiding our work throughout Partners for Change are data. So it's having timely and practical data to inform and drive your co-created interventions within your county. And then focus, and that's informed, data-driven, timely and targeted interventions that are kind of through timing, location, plausibility, and feasibility. It's kind of how we define that focus. And then collective impact and community engagement. So collective impact, having those kind of core components of the collective impact framework. So that's a common agenda, shared measurement and data, mutually reinforcing activities, open and continuous communications, and having a backbone in coordinating organizations. So all of the organizations that I previously mentioned are the backbone organizations for their county, and they convene their key stakeholders quarterly to kind of discuss the initiative and how they're implementing the initiative within their county on top of the work that they're already doing. And then the 4th component is the learning collaborative, which Dominique touched on, and then Dr. Greenberg will also add some information about the learning collaborative as well. And then these collaborative efforts kind of help us have a focus that is data-driven and that's also co-created within community, which is kind of a core component of our work together to drive infant mortality reduction across the state. And that's kind of inspired by the Cradle Cincinnati model because the work that we're doing isn't placing work that's going on in existing counties. It's happening in coordination with what they're already doing. And I will kick it off to Dr. Greenberg.
Okay, thanks, Megan. Good afternoon, everybody. Appreciate the opportunity to chat with you today. Just a couple of comments on the previous slide. And you don't need to go back to it, Megan, but I think you pointed this out, but it's worth re-emphasizing that what we're trying to do in our work with the 4 other counties is support their journey at the county level to reduce infant mortality specifically to their county. So context is really important. And we're not trying to replicate or clone Cradle Cincinnati for these places. They all have, as you heard, ongoing efforts. And we're simply trying to help them adopt principles that we've found very, very useful in our own work that we think are transferable and can improve their effectiveness. So that's really the goal behind Partners for Change. And it's been a lot of fun to get started with this work. A couple of comments in that around what works and what doesn't work. You've heard a bit about Queens Village, and this slide is to remind you of what Dominique had described earlier in terms of what Queens Village is. This is really, really important because if you do the math and forget about any other issues about what's the right thing to do or what have you, if Black infant mortality doesn't decline significantly for our county or any of the other counties that we're working with, the total infant mortality rate won't decline in a significant way. And that's a reflection of the racial disparity of infant mortality that I know you're all familiar with. we believe, based on work that Meredith Smith, our executive director, initiated back in the mid-teens in 2016 and 17, that the approach of Queens Village is a very, very important way to do that. So the Partners for Change work includes establishment and development of a Queens Village chapter, if you will, in each site. So that's one important piece of the incorporation or integration of the Cradle Cincinnati model. The other is the Learning Collaborative. The Cradle Cincinnati Learning Collaborative, as it says on the slides, a network of people who provide health care. So these are not public health providers, these are healthcare providers like myself. And they work together. The idea behind the Learning Collaborative is working together to affect systems change in healthcare settings that's important. And if you're interested in more details, we can surely share with you details about the work of the Learning Collaborative, but this is, we found a really, really key piece of the puzzle in terms of infant mortality reduction, because you can have all sorts of wonderful benefits and support for women. But at the end of the day, having a baby is a biological event. And for almost every woman, it takes place within a hospital system. So those things matter. And the Learning Collaborative was our first foray into addressing systems that did not serve women, and in particular did not serve Black women to the betterment of their health and pregnancy outcomes. Next slide. There it is. It's pretty sleepy, Megan. Doesn't, but just a couple of quick observations, what we learned so far. We've been at this Partners for Change work since May. So we're still in a learning phase, I would say. And we've said from the beginning to DCY and to our partners across the state that we're all learning as we progress on this journey. And certainly we've looked at this as a real opportunity to learn from our colleagues at the other 4 counties. But several things have emerged, I guess. One is the importance of a backbone organization. You heard Megan describe collective impact. Collective impact is a framework. Megan shared with you the 5 tenets of or components of collective impact, one of which is having a backbone organization. You can think of that organization as the group of people who are thinking about the problem, infant mortality, every day, every hour of every day. Maybe not when they're sleeping, but otherwise they're thinking about it all the time. And that's really important because collective impact then relies on interaction with a large group of stakeholders. Dominique mentioned our service arm, Cradle Cincinnati Connections. That's one of numerous service organizations within Hamilton County that are providing care services, if you will, to women that are relevant to infant mortality reduction. We've got to interact with all of them and support all of them, not just our own Cradle Cincinnati connections, but everybody. So a backbone organization that's effective does that. And the counties, the 4 counties are working on that. And I'd say are at different stages of developing their backbone organizations, but are making good progress. A couple other things we've learned that in order to do the work effectively, it's really important that healthcare and public health providers work very, very closely together. And you'd think intuitively that that happens, but it doesn't. And we've spent better part of 15 years developing what are now really solid and close working relationships with our local health departments. That, along with the kind of interinstitutional relationships that different healthcare systems might have with one another, which often are those of being competitors rather than being collaborators, are really important to develop as well. Additionally, you got to have the right data. And again, Megan alluded to this, but the idea here is that unless you know why babies are dying, where they're dying, how old they are when they're dying, you're not going to be able to understand which interventions are useful and which are not. So that's crucial. And in order to really have credibility around appropriate interventions, you have to have good relationships. And the counties are working on all these things right now, with at the same time starting to develop concepts around focus of interventions and how they're going to sustain them over time, because that's really important as well. All right, turn it back over to you, Megan, to wrap things up, and then we'll do questions.
Thanks, Jim. And kind of going off of what Jim said about that relationship building and kind of what we've learned along the way through this kind of all teach, all learn model of collective impact that we're utilizing throughout the Partners for Change initiative, we're seeing that there's lots of opportunities for collaboration across the state. So obviously with the Ohio Department of Children and Youth, but also with the Ohio Department of Health, Department of Medicaid, the General Assembly, and for Partner for Change counties, to kind of share what we learned to kind of inform best practices across the state for infant mortality reduction, and to utilize what we learn throughout our partnership and collaboration to kind of focus on effective, realistic, and pragmatic solutions that help Ohio's mom and babies. So we will kick it over to questions now, if anyone has questions.
So we have one in the comments, and then I also have one, but I'll give this one first. So Jasmine Montanez says Lorain County has recently elected Queens Village as strategy in our CHIP. How does a county become a part of Partners for Change?
You can take that one, Megan.
So Partners for Change, it's a grant. So it was started, there were 4 counties that applied. It's the 4 most populous counties. So like I said, Lucas County, Cuyahoga County, Franklin County, and Montgomery County. So they applied to participate in the Partners for Change initiative and were selected by the Department of Children and Youth to participate in the process.
Yeah, we didn't identify the counties. DCY identified the counties for us, and then different organizations applied to be the backbone organization from each county. That being said, we're absolutely happy to talk to folks in Lorain County and help them think through this and get started. We're not in any way trying to be restrictive.
And then I see we have a couple of other questions. So Director Dawson can go first, and then we have one in the chat.
Thank you. Not a question, just want to share that we are so excited that Hospital Council of Northwest Ohio, which is one of our original hubs, we now have 12 hubs across the state. We're just so excited to be a part of the process. I think the more that we collaborate across approaches is going to just drive us closer to establishing very tailored solutions that really get at not just approaches to improve birth outcomes, but I think the synergy will create the desire and the political will to eliminate structural barriers to better birth outcomes. So thank you to each of you for your presentation this afternoon.
Well, you're welcome. It's been fun to work with Lucas County.
Thank you. Yeah. And to learn from them too. We're learning
Yes.
a little bit from every county. So.
Yeah. Okay. Thank you, Director Dawson. So we have a question from Jenna Bradley that says, what are some of the key accomplishments from these last few months of Partners for Change that you're excited about?
So we're actually about to finish our last training for the year, actually on Monday. And then from there, the partners will kind of be building out their community listening sessions to then inform kind of what their strategic interventions will be for their own counties. So very excited to kind of see what all of the counties do and what they hear in their community listening sessions, and then how they kind of apply it to, again, kind of have that co-created, interventions within the community and how they implement them in their own counties.
And I'm excited actually about identifying some of the barriers that the counties are experiencing that I think they didn't really even appreciate before. And we're looking forward to helping them address those barriers. So and some, I guess, more concrete things, the counties have identified backbone organizations. I think that's a major accomplishment. They did that quite quickly. And they're starting to get their arms around some of the data issues associated with infant mortality reduction.
And
And
to piggy off of what Jim said about identifying the backbones, I mean, this grant started in May and we've done, I think, 4 or 5 trainings. And there's been monthly coaching sessions. So really everyone is just kind of moving at the speed of light to, get this work done as quickly as possible because we understand how important it is. So I think that's also just an accomplishment in of itself, just the dedication and all the work of the partners.
And sorry, to piggyback off of what Megan said, I think one of the main accomplishments is this is one of the more, I'll say, recent times that we've been able to like collaborate across county lines.
Mhm.
And so I think that in itself is something that when we look, next year, in the next like couple years looking back, I think it'll be very impactful that we've been able to kind of cross those county lines, have some of these, larger conversations about infant mortality, and then really figure out like how do we create a healthier Ohio overall.
Yeah, I don't know that there's any states that are kind of approaching infant mortality in the way that Ohio is right now. So I think that's really an important call out, Dominique.
And then there's a question in the comment that says it came from me. It's actually from Senator Hicks Hudson, and then I'll follow it up with mine. So the senator asks, can you provide more information about the backbone organizations? What are some examples of how they support organizations in their area?
Yeah, so I mentioned in a couple slides, I can go back to them, but Cuyahoga County, their backbone organization is First Year Cleveland. Lucas County, their backbone organization is Health Council of Northwest Ohio. Franklin County, their backbone is Ohio Better Birth Outcomes, or OBO. And then Montgomery County, their backbone is Roots to Rise, which is located within Dayton Children's Hospital. So these backbone organizations kind of convene all of these partners they convene the Queens Village component, the learning collaborative component, and then they also convene community partners and stakeholders to kind of make sure that everyone, Jim said that the backbone organization, their job is to think about this, every day, every hour of every day. So they're making sure that kind of the partners are doing the same and that everyone's kind of moving forward in alignment so that everyone is kind of on the same page for how they'll implement interventions, all of that, but then also too that making sure that everyone's voice is incorporated within this process, especially for the Queens Village component, and that Black women's voices are centered, and they're empowered through this co-creation process.
And just to add, a backbone organization, you can think of it as a clearinghouse for interventions. So, and by that I mean that the backbone organization shares data with everyone that helps stakeholders understand how a particular intervention might work or not work, and how effective it might be. Backbone organizations are the stewards of the data that's relevant to the problem of infant mortality, which goes beyond infant mortality rates, right? It's things like extreme preterm birth rates, and providing that information again to stakeholders by neighborhood or by zip code, so that stakeholder organizations can understand where to target their work. So there are lots and lots of examples, but hopefully that gives a flavor of what a backbone organization does in the context of the collective impact framework.
This is Senator Paula Hicks Hudson. Thank you for that information, because I was thinking about, while this is supportive, when you use the term backbone, I was thinking more along the lines of not just being a convener or looking at data, gathering data, but also providing some type of support, whether it is information, financial, things like that. So
Yeah.
this is helpful.
Yeah, I'd say it's nuanced. I mean, sometimes the support is financial, but that's not the goal, right? It might be helping supporting a stakeholder organization to get funding by providing resources and so on and so forth, but not being the funder per se, because that gets a little more clumsy. And I'd say a backbone organization also shouldn't necessarily be shy about providing a perspective about what's happening. We had a lot of challenges in Hamilton County with sleep-related deaths, especially over the last few years, despite an improving infant mortality rate. And that's a big challenge for us. And one of the things that we were able to identify just by analyzing the data was a specific practice associated with those deaths involving nursing pillows. So we didn't really wait to get a lot of input. We worked with the health departments to get the word out about nursing pillows and their risks associated with sleep practices. So it depends on the activity, but we're kind of in their business, if you will, often when it comes to infant mortality.
Thank you.
And then
Thank you so much. Oh, sorry, Amber. I was just going to remind everyone too that, we always usually have people put your questions or comments in the Q&A, which is at the bottom of the phone or, on your computer screen as well, I think at the bottom there. But we also do have the ability, if you're in the audience and you want to use the raise your hand function and just speak on the call and ask your question or your comment. You're more than welcome to do that as well. We can unmute you. So just so everyone, if anyone has more questions or wants to talk directly, that ability to do that as well.
And then I just wanted to follow up. I know that you guys said since May you've had 4 or 5 trainings, and then you've had some calls as well with your community partners. I wanted to know if you could tell us a little bit more about what those trainings entail, as far as resources or practices that you're doing to actually implement some of these strategies in the other communities.
Yeah, so the first year of Partners for Change is really the first kind of couple months. So from May 2025 to November 2025 is kind of this building year of kind of showing how we've done things in Hamilton County. And then, however the counties can layer that into the work that they're already doing. So the first training in this summer was data and then our cause of death analysis. And I'll let Jim and Dominique speak a little bit more about that in a second. But so just having access to data and then how we do our cause of death analysis, because it's a little bit different than how other counties have done it. And then we had a collective impact training. So that's kind of goes into that conversation around the backbone. So how are the backbones operating in the community, drawing key stakeholders in, ensuring that, the key stakeholders are at the table. And then we had a needs assessment and asset mapping training. So that's looking at everything that you have in your community, all of your existing community partners, everything that you're kind of currently doing, and then kind of cross-referencing that with kind of what the next training will be, which is the kind of using community voice and then drawing that data piece in to inform your infant mortality reduction strategy. So having your needs assessment and asset mapping to kind of inform that community listening process to ensure that, in your listening sessions, you're listening to Black women, that you're, then from there ideating based on what you hear to say, okay, these are the key themes that we're pulling out. And then from there, kind of informing your strategies around those key themes and co-creating them again within the community. And Dominique and Dr. Greenberg, I don't know if you have anything to add about the data and the cause of death.
Dominique?
Yeah, so I will say from a data perspective, I think one of the things that is unique about Hamilton County is that, like Dr. Greenberg said, we do work really closely with our local health department. And so we have access to data in a very timely manner, meaning we can look at data from last month to really understand what's going on and keep a pulse on the community. And so we're trying to help mirror that in these other counties by working with their local health departments, their backbone organizations, as well as the Department of Children and Youth, to ensure that all of them have access to data in the same capacity. And so that they can look at data in a timely manner, and not be looking at data from 2 years ago, because that's, what's available. But then also sharing kind of the way that we look at the data. And so I think Dr. Greenberg also alluded to, understanding, when infants are dying, what's the main cause of death, what, zip codes do we see increased infant mortality rates in? And so just kind of sharing with them what has helped us better understand our community to then be able to, whether it's go to our partners for support in the work, to do place-based work, or when you're looking at, funding opportunities, you have this rich data to be able to tell you and inform how you design interventions and what types of interventions you may need in your community. And so we're really just, like I said, sharing some of our best practices around that. And then, also looking at when you're tracking this over time, how do you know if the interventions that you are putting forth could potentially have had an impact on your infant mortality rate? And so that's something that I think from inception, Dr. Greenberg and our other co-founder, Dr. Kelly, have really kept at the forefront is, we can continue to monitor this, but how do we look back and see if what we've done has made a statistical impact on the work, or that we can, contribute some of the work to. And so, Dr. Greenberg, I don't know if you want to speak more to that from kind of the long-term perspective of looking at
Yeah,
data.
just very quickly, I think from the beginning, when we started our work in Hamilton County, we looked at the infant mortality rate as a public health crisis and also a healthcare crisis. Lots and lots of infants dying. No one understood why, frankly. And so, our perspective was we need to understand what's going on in a way that we can not only intervene, but pursue interventions that make sense. We don't want to waste time, for sure. We don't want to waste money. We want the infant mortality rate to go down. And just to give you a very, very kind of quick flavor for when we started, there was a lot of thinking in Hamilton County that infant mortality was something that required a focus on infants, right? Because we're worried about infant mortality. Actually, what our data told us very, very quickly over at least a couple of years of work is that it was first trimester care before babies were born that was going to make the biggest difference. So again, I've lots and lots of detail behind that, but it's super important. So that kind of thinking and the process of how you think about your data is what we're trying to transfer to the other 4 counties.
And I think to kind of add on to what Jim said too, it's, our data says one thing and then the other county's data could say something completely different. So that's why it's important that they can kind of tailor those interventions to what is happening in their county. So.
Exactly.
And we do have another question from Director Dawson, but I had a short follow-up that I think is in the same vein as her upcoming question. But so I know that you said you rely on those backbone organizations that have been identified and given grants to enlighten you as to who the community partners are and who's already doing the work. So when you're talking about offering a training that helps to identify best data collection practices and to really map out those very particular issues that contribute to infant mortality, is that something that's open to those smaller community partners that you would then meet through the backbone organization? Or is that something that's just offered to the backbone organization and you expect them to then distribute the information as necessary?
So all of the trainings, the backbone organizations are expected to go to them as to meet their deliverables, but then they're also inviting anyone within the community that they think needs to participate within that training. So like for our data training, it wasn't just the backbone organizations, it was their local health departments that might have had their coroner's office on. It's really kind of up to them who they want to include. Now, the Learning Collaborative and the Queens Village components, those are kind of always integrated because they are kind of the core kind of components that they're adding in as a result of Partners for Change. But it's really kind of up to them. Like it's not we're not trying to be super prescriptive to communities when, we live in Hamilton County and, we know what might work in Hamilton County, but also we're not going to know exactly what works in Lucas County or Franklin County. So, letting those partners and those backbones kind of have that autonomy is really, really important. So because they know their communities best.
Okay, and then Director Dawson's question is, can you share the ways in which you ensure community level input and community-based participatory research so that the community voice is incorporated into the proposed solutions, monitoring the progress and obtaining community buy-in to reinforce their role in resolving the issue?
And that's kind of what the partners are all in the process of doing right now. So they're kind of in that process of doing their community listening session so that they're actually hearing directly from the community, from Black women, centering Black women's voices on what their experiences are in the, prenatal, pregnancy, postpartum, all of those experiences, to then kind of pull out those key themes and then co-create within the community on what solutions, they think are going to work within their county to implement for interventions. And it's really co-creation is, I think, kind of the cornerstone of all of Partners for Change, and that, we're trying to get that community voice so that that community voice is reflected in the actual implementation of those interventions.
And then just to follow up, I apologize if you already said this, but how long is your partnership through these grants with those 4 identified counties?
So it was initiated in May 2025 and runs through June 2027.
And ideally, it'll be just the first step. We didn't solve the problem, or I'm sorry, we haven't solved the problem, but we haven't made progress. It took us 10 years to make progress. So I think that's really important to understand. This is really, really hard work. And it takes real focus and sustained attention and effort to get to where it needs to be. And part of what makes it, the part of that focus is derived from community level input. The previous question about that. It's everything that we do is based on community level input and feedback and iterative, reiterative process of feedback and change as we progress.
And I actually did just have another question. So I know you said you try not to be prescriptive and you let the communities decide what it is they need and to give their own input. But I am curious, because as you said, hopefully this is just the first step. Were there any specific goals laid out for the projects being implemented in these 4 counties? Or can you just say more about that, if there were any specific goals laid out for the end of this 2-year term?
Yeah, so we have like there's a key driver diagram that we have for kind of the whole of the Partners for Change initiative, and then the counties themselves, like everyone's infant mortality rate is not the same in all of the counties. So their goal is probably going to look different depending on, and I'm going to not speak correctly about this, but depending on like statistical evidence of like where their mean is and their averages, kind of how they want to adjust that to kind of best apply it to their community. And I do want to just like the Department of Children and Youth has also been just very supportive in kind of recognizing that, we can show what we've done, but then also to understanding that the counties, like they know their counties best. So it's not about just directly saying that this is what Cradle has done. It's about integrating these kind of components on work that they're already doing to kind of, just have that co-creation, like what Jim said, at the core of kind of what they do.
Thank you all so much. You've had such thoughtful, responses and insights, the program. And I know that you all have been joined with us here before to talk about the work that you do and to see how it's now, manifested across the state, and just using the practices that you've all, seen great results with to just support others who are, attempting to address this issue that's impacting the whole state. I think is truly amazing to see where you're at now. And so I know we're getting a little close to 1 o'clock, and I just want to make sure that if there's anyone else too that has any questions or any comments that they would like to leave, please feel free to do so. I know Senator Ingram was able to join on the call. So Senator, also, I didn't know if you wanted to jump in at all and say anything since I know you weren't able to be on at the beginning. But just thank you all so much really for the work that you're doing and being with us today to talk about that.
No worries.
I will say this, thank you, Deja. Thank you, Amber. And I know I heard Senator Hicks Hudson at one point, and my technology is like, we do what we want to do. But one of the things I want to make sure that we understand, and this is, the dollars are in the budget and it's on the biennium. And of course, we'll be looking at those numbers when we get to the next operating budget, which of course will be in the next General Assembly. But the intent is not just of the 4 counties. I heard somebody ask about the 4 counties and then how do we join? And of course, that whole collaboration with children and youth and the health department is important for us to make sure that we're paying attention to where we need that service the most. And so
Right.
it doesn't mean that nobody's doing anything else anywhere else. As a matter of fact, we want you to tap into what you're seeing that's going on. And this is why we kind of convene, because then you need to be able to say back to us, not only do you need more dollars in the operating budget, we need to make sure that we have opportunities for other folks to be served, unless, we want Ohio as a whole to continue to be in the position that it is right now. And that's exactly what we're trying to eliminate. So thank you for being on at all and for the presentation that I did hear, because I didn't hear it all, I have to admit. So I'm going to be one of those people that has to go back and listen again. But thank you all so much. And Deja, if you guys have any more questions, I do know that Dr. Shockley sent me a message earlier that she was called out of town, and of course that sounded like it was important for her to go. So anyway, and you guys did a great job. So thank you.
Sure. Thank you.
If I can just jump in real fast and also add my thanks to the information and the work that you're doing. And I echo what Senator Ingram just said about looking at how, moving forward, we can continue to make a dent in this scourge that makes no sense for us to, in our state, to have these types of statistics, and that we do know that there are ways in which to address them. At the state level, we just need to have that political will to do it. And I think that the work that you're doing is going to help us, try to move that needle. So I too want to thank you, and also thank Amber and Deja for, as I said at the outset, really helping to keep us on track. And with that, if there's nothing else, we'll say have a great rest of your day and happy Thanksgiving.
Thank you.
Thank you. Happy holidays.
Thank you all for being here. We'll send the recording out to everybody, and just everyone remember our summit is in April, 2nd annual, so we'd love to have everyone there. But yeah, thanks for being here.
Yes, thank you.
Bye.